What happens when a city becomes ground zero for the deadliest drug epidemic in American history? What happens when streets that once echoed with the footsteps of founding fathers now witness the shuffling gait of the walking dead? What happens when the birthplace of American freedom becomes a graveyard of American dreams? Welcome to Philadelphia in 2025, where fentanyl has transformed entire neighborhoods into apocalyptic scenes that would make horror movie directors weep. This is not fiction. This is not exaggeration. This is the terrifying reality of what America's third deadliest drug crisis has done to the city of brotherly love. Every day, Philadelphia records an average of 4 overdose deaths. That's one person dying every 6 hours from fentanyl poisoning. In 2023 alone, over 400 people died from overdoses in this single city, more deaths than from homicides, car accidents, and suicides combined. To put this carnage in perspective, Philadelphia loses more residents to fentanyl each year than some small towns have in total population. But death statistics tell only part of this nightmare story. For every person who dies, dozens more exist in a zombie-like state of addiction, shuffling through neighborhoods like Kensington, where open-air drug markets operate 24 hours a day with impunity. An estimated 75 people in Philadelphia struggle with substance abuse disorders, with the vast majority now addicted to fentanyl, a synthetic opioid 50 times more potent than heroin and 100 times more potent than morphine. The homeless population has exploded alongside the fentanyl crisis. Over 50 people now live on Philadelphia streets, with nearly 70% struggling with active addiction. Encampments filled with blue tarps and cardboard shelters have sprouted under highway overpasses, in abandoned lots, and along railroad tracks, creating shantytown settlements that house the living dead people so consumed by fentanyl that they appear to be breathing corpses. These are not just numbers on government reports. These represent human beings whose lives have been obliterated by a drug so powerful that it can kill with a dose smaller than a grain of salt. These statistics represent mothers, fathers, children, veterans, college graduates, and working professionals who fell into a chemical hell from which few ever escape. How did we get here? How did the city where liberty was born become a necropolis where hope goes to die? The answer lies in understanding fentanyl itself, a drug so devastating that it has fundamentally altered the nature of addiction, overdose, and recovery in ways that previous generations of drugs never could. In the Kensington neighborhood of North Philadelphia, something unthinkable is happening in broad daylight on American soil. Walk down Kensington Avenue, once a thriving commercial district with family-owned shops and middle-class homes, and you'll witness scenes that defy belief in a developed nation. Bodies lean against brick walls at impossible angles, their eyes rolled back, their breathing so shallow it's barely detectable. Others lie motionless on sidewalks, their skin a grayish-blue color that signals impending death from oxygen deprivation. Some stand frozen in place for hours, locked in positions that would be painful for a healthy person to maintain for minutes, a phenomenon users call the lean or zombieing out. This is what fentanyl does to human beings. Unlike previous generations of opioids that produced euphoric highs followed by periods of relative normalcy, fentanyl creates a walking death state where users exist in a twilight between consciousness and coma. They can appear dead while still breathing, unresponsive to sound, touch, or pain, yet somehow remaining upright. Maria Santos, a mother of 3 who became addicted to fentanyl after a workplace injury led to prescription painkillers, describes the experience. You're not really alive, but you're not dead either. You can hear people talking, but you can't respond. You want to move, but your body won't listen. It's like being buried alive in your own skin. The drug has transformed Kensington into what locals call the Badlands or Zombieland. By 9 a.m., dozens of people are already lined up along Kensington Avenue, waiting for dealers who sell fentanyl in small bags with brand names like Zombie, Death Wish, and Final Call. The irony of these names is lost on users whose addiction has progressed beyond the point where fear of death can motivate behavioral change. Dr. Sarah Mitchell, an emergency physician at Temple University Hospital, treats overdose victims daily. "I've been working emergency medicine for 15 years, she explains, "and I've never seen anything like fentanyl. Patients come in clinically dead, no pulse, no breathing, blue skin, and we bring them back with Narcan. only to have them leave and overdose again within hours. Some I've revived 5, 6, 7 times. The visible horror of Kensington has spread to other neighborhoods throughout Philadelphia. Rittenhouse Square, once an elegant district of upscale shops and restaurants, now has business owners hiring private security to remove unconscious drug users from their doorways. University City, home to the University of Pennsylvania and Drexel University, sees college students stepping over bodies of overdose victims on their way to class. But perhaps most disturbing is how normal this apocalyptic scenario has become for Philadelphia residents. Children walk to school past scenes of open drug use and unconscious bodies. Commuters plan alternate routes to avoid stepping on syringes. Mothers push strollers around human beings who may be dying on sidewalks. This normalization of horror represents perhaps the most devastating aspect of Philadelphia's fentanyl crisis, how a city can adapt to hell until hell feels like home. The transformation of Philadelphia into a city of walking dead didn't happen overnight. It represents the culmination of multiple interconnected crises that created perfect conditions for fentanyl to devastate entire communities with unprecedented speed and lethality. Fentanyl first appeared in Philadelphia's illegal drug supply around 2013, initially mixed with heroin to increase potency and reduce costs for dealers. What made fentanyl attractive to drug traffickers was its incredible efficiency. A small amount could produce the same effects as much larger quantities of heroin, making it cheaper to smuggle and more profitable to sell. But fentanyl possessed characteristics that made it far more dangerous than any previous street drug. Its potency meant that the difference between a dose that produces the desired effect and a fatal overdose is microscopic, literally measured in grains of salt. Even experienced drug users, accustomed to gauging doses based on heroin's effects, began dying in massive numbers because fentanyl's strength varied wildly from batch to batch. Worse, fentanyl's chemical structure allows it to be manufactured entirely in laboratories using precursor chemicals imported from China and Mexico, eliminating the need for poppy cultivation required for heroin production. This meant that supply could be increased rapidly and cheaply, flooding American cities with quantities of synthetic opioids that dwarfed anything seen in previous drug epidemics. Dr. James Rodriguez, a toxicologist who studies fentanyl's effects, explains the drug's unique lethality. Fentanyl binds to opioid receptors in the brain with extraordinary strength and doesn't release easily. This means that even after users appear to recover from an overdose, they can slip back into respiratory depression as the Narcan wears off. We call it the fentanyl trap. Users get caught in cycles of overdose and revival that often end in death. Philadelphia's existing vulnerabilities made it particularly susceptible to fentanyl's devastation. The city already had high rates of prescription opioid addiction stemming from overprescribing practices in the 1990s and 2000s. When regulatory crackdowns made prescription pills harder to obtain and more expensive, users turned to illegal alternatives. Heroin had been the primary substitute, but fentanyl rapidly displaced heroin in Philadelphia's drug markets because dealers could make much higher profits. By 2018, over 95% of street drugs sold as heroin in Philadelphia actually contained fentanyl, often with no heroin present at all. Users who thought they were buying heroin were actually purchasing a drug 50 times more potent. The COVID-19 pandemic accelerated Philadelphia's fentanyl crisis in multiple devastating ways. Lockdowns isolated people struggling with addiction from support systems and recovery resources. Economic devastation pushed more people toward drug use as an escape from joblessness, eviction, and despair. Social distancing made group therapy and support meetings impossible, leaving addicted individuals without crucial peer support. Perhaps most critically, pandemic disruptions to illegal drug supply chains led to increased adulteration of street drugs with fentanyl. Dealers, facing supply shortages of heroin and cocaine, began mixing fentanyl into everything to maintain profits. Users who had never used opioids before began dying from fentanyl-contaminated cocaine, methamphetamine, and even counterfeit pills sold as Xanax or Adderall. The result was an explosion in overdose deaths that overwhelmed Philadelphia's emergency response systems. In 2020, overdose deaths increased by 35% compared to the previous year. In 2021, they increased another 22%. By 2022, Philadelphia was experiencing the highest per capita overdose death rate of any major American city. But statistics cannot capture the human horror of watching an entire city slowly die. Emergency rooms became morgues. Families began planning multiple funerals in single years. Children grew up thinking it was normal to see dead bodies on sidewalks. Community-based responses have shown more promise than law enforcement or traditional treatment approaches. Organizations like Prevention Point Philadelphia provide comprehensive services, including needle exchange, wound care, mental health counseling, housing assistance, and job training, recognizing that addiction occurs within contexts of poverty, trauma, and social isolation that must be addressed simultaneously. Peer recovery specialists, people with lived experience of addiction who have achieved long-term sobriety, have proven particularly effective at engaging fentanyl users who distrust traditional authorities and service providers. These specialists can build relationships based on shared experience and provide realistic hope for recovery. Philadelphia has also invested in family support programs, recognizing that addiction devastates entire families and communities, not just individual users. These programs provide counseling, support groups, and practical assistance to parents, spouses, and children affected by their loved one's addiction. Despite these comprehensive efforts, Philadelphia's fentanyl crisis continues worsening because the fundamental drivers remain unaddressed. Until the city can provide adequate mental health care, affordable housing, living wage employment, and social support for all residents, drug use will continue serving as escape from conditions that feel unbearable. The human stories behind Philadelphia's fentanyl crisis reveal how quickly and completely this drug can destroy lives that appeared stable and promising. These are not cautionary tales about moral failings or poor choices. They are horror stories about a chemical weapon that can enslave anyone who encounters it. Rebecca Walsh was a 32-year-old elementary school teacher with a master's degree in education when she was prescribed oxycodone following surgery to repair a herniated disc. When her prescription ended but her pain continued, she began buying pills from a coworker. When pills became too expensive, someone suggested she try heroin, which turned out to be fentanyl. I went from having my own classroom and apartment to living under a bridge in 6 months, Rebecca recalls. Fentanyl doesn't care about your education, your family, or your future. It only cares about making you need it more than you need to breathe. Rebecca overdosed 11 times in 2 years, with her sister finding her unconscious and blue on 3 separate occasions. She lost her teaching license, her apartment, and custody of her daughter. Today, after 18 months in residential treatment, she works at a recovery center, helping other professionals who fell into similar traps. Michael Santos was a Iraq War veteran who developed chronic pain from injuries sustained during his deployment. The VA prescribed him opioid painkillers for several years before discontinuing them due to new prescribing guidelines. Unable to function with untreated pain and undiagnosed PTSD, Michael turned to street drugs and quickly became addicted to fentanyl. "I survived 2 tours in combat zones," Michael explains, "but I couldn't survive fentanyl. It was harder to quit than anything I faced in the military. At least in Iraq, you could identify the enemy." Michael lived in Kensington encampments for 3 years, overdosing repeatedly and cycling through emergency rooms, jails, and short-term treatment programs. His family staged multiple interventions, but fentanyl's grip proved stronger than his desire to recover. He finally achieved sobriety through a long-term residential program specifically designed for veterans, but only after losing his marriage, his home, and nearly his life. Lisa Thompson's story illustrates how fentanyl has contaminated other drug supplies, killing users who never intended to use opioids. Lisa was a college student who occasionally used cocaine recreationally at parties. One night, she purchased what she believed was cocaine that had been contaminated with fentanyl during drug trafficking. "I wasn't an opioid user," Lisa's mother explains. "She didn't have an addiction problem. She made one mistake at a party and it killed her. One line of contaminated cocaine was enough to stop her heart." Lisa's death represents hundreds of similar tragedies, where people died from fentanyl exposure without knowing they had consumed it. These accidental overdoses have created terror among recreational drug users and parents who realize that experimentation with any illegal substance now carries risk of immediate death. The story of the Martinez family shows how fentanyl addiction destroys multiple generations simultaneously. Carmen Martinez became addicted after being prescribed painkillers following a car accident. Her addiction progressed to fentanyl, leading to her losing custody of her 3 children, who were placed in foster care. Her oldest son, Miguel, began using drugs at age 14 as a way of coping with his mother's addiction and family disruption. By 16, he was also addicted to fentanyl and living on the streets. Carmen's parents, both in their 70s, exhausted their retirement savings on treatment programs and legal fees, trying to help their daughter and grandson. This drug didn't just destroy Carmen, her father explains. It destroyed our entire family across 3 generations. It took our daughter, our grandson, our savings, and our hope. Today, Carmen has been sober for 8 months and has regained custody of her youngest child. But Miguel continues struggling with addiction. The family's recovery remains fragile and incomplete, illustrating how fentanyl's destruction extends far beyond individual users. These personal stories multiply across Philadelphia, with virtually every family, neighborhood, and institution affected by fentanyl either directly or indirectly. Schools report increasing numbers of students dealing with parents' addiction or overdose deaths. Employers struggle to maintain workforces as employees disappear into addiction or die from overdoses. Healthcare systems are overwhelmed by the constant crisis of overdose response and addiction treatment. Perhaps most tragically, children growing up in Philadelphia today consider scenes of drug use, overdose, and death to be normal parts of urban life. They develop trauma responses to situations that would horrify adults in other cities, creating psychological wounds that may affect them for decades. The normalization of horror represents perhaps fentanyl's most lasting damage, how it has rewired an entire city's understanding of what constitutes acceptable human suffering. Philadelphia's fentanyl crisis serves as a warning for cities across America about what happens when synthetic drugs combine with social inequality, inadequate healthcare, and ineffective drug policies. What began in Kensington has spread to every neighborhood in the city and is now appearing in suburbs, small towns, and rural communities that never experienced significant drug problems. The lessons from Philadelphia are sobering. Traditional approaches to drug policy, addiction treatment, and criminal justice prove inadequate when confronting synthetic drugs that can kill instantly and create dependency within days. New approaches are urgently needed, but they require political courage, significant investment, and willingness to prioritize public health over moral judgment. Some cities have begun implementing Philadelphia's innovations before their own fentanyl crises reach catastrophic levels. Seattle, San Francisco, Portland, and other cities are expanding naloxone distribution, opening safe consumption sites, and investing in peer recovery services based on Philadelphia's experiences. However, the fundamental drivers of drug epidemics, poverty, trauma, social isolation, inadequate mental health care, and lack of economic opportunity remain unaddressed in most communities. Until American society commits to providing all residents with housing, healthcare, education, and meaningful work, drugs will continue serving as escape from conditions that feel unbearable. The COVID-19 pandemic demonstrated that Americans can mobilize extraordinary resources quickly when facing threats to public health. Vaccines were developed, produced, and distributed within months. Economic support was provided to prevent mass homelessness and starvation. Emergency healthcare capacity was expanded overnight. The fentanyl epidemic represents a public health emergency far more deadly than COVID-19 for many communities. Yet the response has been fragmented, underfunded, and hampered by moral judgments about who deserves help. Until fentanyl addiction is treated as a medical condition requiring comprehensive healthcare response rather than a criminal justice problem requiring punishment, the death toll will continue mounting. Philadelphia's experience also demonstrates the importance of harm reduction approaches that prioritize keeping people alive over achieving immediate abstinence. Safe consumption sites, needle exchanges, and naloxone distribution save lives even when users continue using drugs. These interventions buy time for people to eventually enter recovery while preventing the permanent solution of death. The city's struggles with implementing evidence-based interventions reveal how political opposition can override public health necessity. Safe consumption sites have proven effective at reducing overdose deaths in dozens of countries, yet legal challenges prevent their operation in most American cities. This pattern of allowing ideological opposition to block life-saving interventions appears throughout American drug policy. Perhaps most importantly, Philadelphia's crisis illustrates how quickly synthetic drugs can transform cities and destroy communities in ways that natural drugs never could. Fentanyl's laboratory origin means that supply can be increased rapidly and adapted to defeat countermeasures. New synthetic drugs, even more potent than fentanyl, are already appearing in drug markets, suggesting that this crisis may be only the beginning of a longer synthetic drug epidemic. The window for preventing other cities from experiencing Philadelphia's devastation is rapidly closing. Fentanyl has now appeared in drug supplies in every American state, and overdose deaths are increasing in communities that previously had minimal drug problems. The spread pattern suggests that what happened in Philadelphia represents not an isolated urban crisis, but the early stages of a national catastrophe. As we witness Philadelphia's transformation into a city of walking dead, the question facing America is not whether fentanyl will affect other communities it already has. The question is whether we will learn from Philadelphia's experience and implement evidence-based responses quickly enough to prevent mass death, or whether we will repeat the same failed approaches that allowed this crisis to reach apocalyptic proportions. The answer to that question will determine whether fentanyl turns American cities into graveyards, or whether we can develop new approaches to protect human life and dignity in the age of synthetic drugs. Time is running out, people are dying, and the walking dead are spreading beyond Philadelphia's borders into communities across America. Walking through Philadelphia today feels like witnessing the slow-motion collapse of American civilization. In the city where the Declaration of Independence proclaimed that all humans possess unalienable rights to life, liberty, and the pursuit of happiness, thousands of people exist in chemical slavery so complete that death becomes preferable to another day of withdrawal agony. The sight of human beings reduced to zombie-like states on public streets represents more than a drug crisis. It represents a moral crisis about what kind of society America has become and what kind of society we want to build for future generations. When children grow up thinking it's normal to see unconscious bodies on sidewalks, when commuters plan routes around areas where humans lie dying, when emergency responders become numb to scenes of mass casualties, something fundamental has broken in the social contract. Fentanyl has exposed the inadequacy of every American institution tasked with protecting public health and safety. Healthcare systems focused on profit over patient care created the prescription opioid crisis that preceded fentanyl addiction. Criminal justice systems focused on punishment over treatment have filled prisons with addicted people while failing to address trafficking networks. Social service systems overwhelmed by demand and underfunded by legislators have left vulnerable people without support. Most devastatingly, political systems focused on blame over solutions have prevented implementation of evidence-based interventions that could save lives immediately. While politicians debate the morality of safe consumption sites, people die from preventable overdoses. While legislators argue about funding priorities, families bury children who could have been saved with adequate treatment resources. The fentanyl crisis demands a fundamental rethinking of American approaches to addiction, mental health, poverty, and social support. Traditional models that rely on willpower, punishment, and moral judgment have proven completely inadequate when confronting synthetic drugs that can override human decision-making capacity within days of first use. What Philadelphia needs, what America needs, is a public health response as comprehensive and well-funded as military responses to foreign threats. This means treating addiction as a medical condition requiring healthcare intervention rather than a criminal justice problem requiring punishment. It means providing housing, healthcare, education, and employment opportunities that make sobriety more attractive than chemical escape. Most importantly, it means recognizing that people struggling with addiction remain human beings deserving of dignity, respect, and life-saving interventions regardless of their current circumstances or past mistakes. The walking dead of Philadelphia are not zombies or monsters. They are human beings whose lives have been hijacked by chemicals designed to create dependency. Behind every unconscious body on a Philadelphia sidewalk lies someone's child, parent, sibling, or friend. Each person caught in fentanyl's grip once had dreams, talents, relationships, and potential for contribution to society. The tragedy is not just that they became addicted. The tragedy is that American society has given up on them, written them off as expendable casualties in a drug war that creates more victims than it saves. The choice facing Philadelphia and America is clear. We can continue policies that have transformed cities into graveyards, or we can implement comprehensive public health responses that prioritize saving lives over maintaining moral purity. We can continue to allow synthetic drugs to create armies of walking dead, or we can invest in treatment, housing, healthcare, and social support that enables recovery and redemption. The fentanyl epidemic will end eventually, either because we develop effective responses that save lives and rebuild communities, or because it kills everyone susceptible to addiction and burns itself out through mass death. Philadelphia has chosen to fight for its residents' lives through innovative harm reduction and treatment programs. The question is whether other cities will learn from Philadelphia's experience quickly enough to prevent their own transformation into cities of walking dead. Time is running out, people are dying, and the walking dead are spreading beyond Philadelphia's borders into communities across America that believe they are safe from synthetic drug epidemics. They are not safe. No community is safe. And unless Americans demand comprehensive public health responses to the fentanyl crisis immediately, Philadelphia's horror story will become America's horror story. The city where American independence was declared now faces a choice about whether to declare independence from policies that prioritize punishment over healing, ideology over evidence, and moral judgment over human life. The outcome of that choice will determine whether Philadelphia rises from its current ashes or continues burning while the flames spread to engulf the entire nation. This is not just Philadelphia's crisis. This is America's crisis, and it's worse than you think.